Hi, everybody. I'm Don Lee. Welcome to the 14th episode of the Business of Healthcare show, HCBiz. I am in Buffalo, New York. I'm the vice president at Zen PRM. And we started this chat and show going back, like as I said, 14 weeks now to look into the issues that our healthcare organizations and startups and other companies trying to launch solutions into healthcare are facing, and look at them from a very practical standpoint of what are the issues that are kind of slowing things down, what are the things that are causing them, and are those things in our control? It's I always like to say it's like an innovation serenity prayer. We want to identify if we can do something about it and do it, or identify we can't and work around it. And that's the tack we take every week. We've got a great topic and a great guest today to look at a very important topic of healthcare security and compliance and patient privacy. And we're going to be coming at it with that normal HCBiz angle of, what are the issues we're dealing with? What are the risks organizations are facing? And what can and should they start doing about it right now? What resources are available to them? And then finally, what opportunities exist out there for be it a startup or be it an established company that wants to bring a new product to market? Where are the gaps in tools, in services, in cyber insurance, things along those lines? And that's what we're going to get into today. So with that, just quick introduction for my co-host, Shahid Shah. I don't know if you want to jump in and talk or if you just want to wave, that's fine. And of course, our guest here, Niam Yaraghi of the Brookings Institute. Thank you so much for joining us. I have your paper here. Everybody should read this. It was fantastic. Very well done. Hackers, phishers, and disappearing thumb drives. Lesson learned from major healthcare data breaches. A thorough treatment of the topic, and that definitely I read very well in terms of the other examples of the set I went through. So nice job. And if you wanted to just give a quick intro of yourself, and then I wanted to just take a minute and talk about what you've done here with the paper and what was the thinking and why you got into that.
Sure. Well, hello and good afternoon, everybody. My name is Niam Yaraghi. I'm a fellow here at the Brookings Institute Center for Technology Innovation, and my research is primarily focused on health information technology. I look at many different aspects and issues within this domain, and lately I was intrigued with the status of privacy in the healthcare domain, so I started working on this report, which was released 2 weeks ago.
Excellent. And again, just for setup, if you can talk about what was the logic behind the report. I know you identified that there's a big opportunity that we're missing out on here in terms of the sharing and getting this information out there. And that was, I believe, was that the basis for the report? Is that how you started down this path? And then what did you do about it?
Yes, that, and also a personal curiosity to see why is it always mentioned that medical data is worth so much in the black market, and why there are so many privacy breaches happening in the healthcare sector and not in the other sector. So these two questions were my personal drivers to go and talk with as many people as I could in the industry and ask them these two questions. And hey, why are you doing such a lousy job? Why are there so many privacy breaches happening in the healthcare sector? And then the conversation started from there. And then, I learned a lot of things about the reasons for which the healthcare industry is so vulnerable to privacy breaches. And I was educated on the fact that I cannot compare apples with oranges and say there are specifically more breaches in the healthcare sector because while there are very strict requirements on reporting the incidence of breaches, there are not similar requirements in the other industries. So it may be the fact that there are other breaches happening in retail industries or banking industry, but because the reporting requirements are not as strict as healthcare, we end up knowing about the things that went wrong in the healthcare industry, but we don't know what is going wrong in the other industries, and we end up, having more information about healthcare and not about other things, and just become biased and think that there are more breaches happening in the healthcare industry.
Yeah, that's a really good point. And I think you also touched on the fact that it's the media loves the story, which gets it out there too. So sure, the regulations that you have to report might feed that as well. But I think healthcare and healthcare data is just such a personal thing for everybody that it makes it a compelling story, and that makes them report it more than something else. It's kind of like, if an airplane runs off a runway and nobody gets hurt, that's national news for the day. But a much more serious situation involving automobiles elsewhere just isn't reported. So I think that, that type of thing feeds into it as well.
Absolutely.
So what did you attempt to do here? So the basis was that huge opportunity. These groups are being breached. Behind the scenes, the hackers, at least the ones that involve hackers, let's say, they are identifying gaps in security and ways to get in. And those groups, theoretically at least, have a way to help and share each other. And then the groups that are getting beat, the healthcare organizations that have been, had data exposed, that's a big secret, and there's not a lot of avenues for them to go out and share. So looking at that, my read is that you decided to go out and talk with all of them and try to fill that void, if you will. Is that a fair assessment?
To be frankly honest, I really didn't know that they're not sharing that information. I was under the assumption that, if something happens, at least the CIOs have tools and opportunities to go and talk with each other and share about their experiences. And there are some tools. So, and platforms, ISAC's been one of them. Although theoretically it's possible for them to exchange that information with each other, in reality it doesn't happen as often as it should.
Mm-hmm. Gotcha.
So when I was talking with many of these CIOs, they were more excited than me about this report, because they were saying, hey, in other industries, there are tons of other annual or even quarterly reports about the state of privacy and IT security. And, there are various kinds of communication methods like newsletters and, email tip sheets and everything. But we don't know what is going on in our own industry. So I guess they were much more excited about this report and wanted to read it as soon as it gets out. Much more than I personally was excited about the report.
Oh, well, that's good. It came out with an audience already. I like it. All right. So coming at this then, again, from that HCBiz, what is really the problem facing the businesses today, and what should they be doing about it? That's where I'd like to start going down that path. And usually when things aren't being done, or they're not being done well, it's because they aren't seen as valuable to those organizations, or at least they're not seen as valuable as the other things that they're prioritizing ahead of it. And that's I'd like to start there. We had some conversation about that on the tweet chat. I think we had a nice exchange. But what, talking to a healthcare organization, let's say I'm a CISO, and I'm trying to make a case to the rest of the leadership of my company and get the appropriate funding and get my projects through. What am I telling them? What are our real risks that we're facing today? That
I think if you are a CIO in a hospital, that is the most important and frankly most difficult part of your job, to go and talk with the hospital leadership and persuade them to allocate funds to you to go and spend on security. Mm-hmm. Because as one of these organizations told me, the belief out there, which I think is true, and it's at least it's rational, is that every dollar spent on IT security in a hospital is equal to a dollar not spent on treating patients. Mm-hmm. And when you consider the fact that hospitals are already operating on a very slim profit margin, the issue becomes even more significant. Healthcare security and patient privacy is not on the top of the list of the priorities for healthcare organizations. to allocate their resources on. And the fact that they already don't have a lot of resources makes it even worse. And it becomes even worse in the cases where you're dealing with a nonprofit organization that its only source of revenue is through grants. And those are the organizations that were telling me, hey, we are a nonprofit organization and we operate based on grants. And there are two types of grants that we can have. The first one are the specific grants. So there is an organization say, I'm going to give you $10 million to go and spend on treating this specific disease. So, our hands are completely tied by agreement. We have to spend it on a specific mission and not IT security. And then the second type of grants that we have are the general grants that entails, hey, go and spend it on whatever you want. And when we have those grants, the last thing that we could think about is, hey, let's go beef up our security. When we have all those other core and more important and instrumental healthcare-related issues that we have to address in our organization. So whether you're a for-profit or non-profit healthcare organization, spending in security and patient privacy and protecting patient privacy is pushed down the list of your priorities because, first of all, you don't have those resources. And if you have them, you prefer to spend them on your core business positions and core business. And then, putting these all together, you see a situation. And the more important thing, the other important thing is that if something happens and you experience a privacy breach, at least up until very recently, it wouldn't have a serious and significant impact on your revenue stream. So imagine that you're a community hospital in a geographical region, and you happen to have a breach, or you lose the medical information of a couple of thousands of your patients. It really wouldn't affect the decision of your future patients about whether or not they want to come to your hospital or not, because they don't have a lot of choice there. Right? But that's not the case for other types of business. If I'm having an account with Bank of America, and if they experience a privacy breach, then the second time I may think about going to HSBC to open a new account rather than continuing my relationship with Bank of America. So while for them it is a question of day-to-day operations and something that directly affects the revenue stream for banking and retail, it is a must-have. But for healthcare organization, it is a nice-to-have kind of a thing. I was talking with one of the major players in providing security technologies and services for the healthcare system, and they were mentioning that most of their clients are the ones that are also the best in providing care. So, the usual names that you hear, Johns Hopkins, Cleveland Clinic, Mayo Clinic are on the list of their clients. And I told them, hey, it's not because they necessarily care more about privacy than a small community hospital. The reason that they are your clients is because they have the resources to spend on your services. It's a luxury. It's a very nice thing to have. Mm-hmm. But that other small hospitals, they really do not have the financial resources required to pay for your services. Although it's a nice thing and it's always makes sense to protect patient privacy, but when you don't have the money and then you have much more important areas to spend that money that you may finally get your hands on, then obviously patient privacy would be ignored.
Okay, so two questions for you on that. First one is, do you think that the changes in the market that are happening right now, where patient's first dollar is hitting the hospital or the payer first, and now some more choices coming. So when I'm going to buy an insurance plan, maybe I'm doing so on exchange, so I have a lot more choice. And in care delivery, I'm starting to see more choice. do the consequences of those breaches start to become more significant, start to more align with the bank example you gave?
Absolutely. And there are a couple of good things. The first one is that with the push towards integrated and connected health services, almost all the healthcare providers out there are gone digital, and now they heavily rely on their IT systems in order to be able to operate. In the MedStar ransomware case, less than 2 or 3 months ago here in DC, we heard that they started to turn patients away because without their electronic health record systems and other IT networks, they were literally paralyzed and were not able to provide their services to their patients. So this is a new era in which without computers and without a robust digital network, healthcare providers would not be able to achieve their goal. So that brings the security up in the list of priorities, because now, hey, if you want to be able to make money, and I want to emphasize on it, if you want to be able to make money and bill insurance companies, you have to see patients and you have to have an EHR system that is running. So you cannot tolerate being a victim of a ransomware attack or a denial of service attack. So that is one of the things that is happening. And the second thing is that, again, with the shift towards the payment models and the slow but steady efforts towards bringing patients into the center of the healthcare services and empowering and enabling patients to make choices, then healthcare is becoming more competitive. So if, as a patient, I'm being provided with the opportunity and the information that is required for me to make a good choice about which of these two specialists I should go to, or even before that, which of these primary care physicians I should choose, or if I have a bigger problem, shall I go to Johns Hopkins or shall I go to Cleveland Clinic? Then privacy would become, eventually, not now, but eventually would become a factor that I would consider in making my choice about, selecting my healthcare providers. So I think competition to gain the business of the patients would lead the healthcare organizations to also, invest on this. So to summarize, I think there are two things. The first one is that, they cannot afford not to be secure, and it will be a marketing and business incentive behind becoming more secure to attract more patients. So I think the industry is at least on the right path.
Got it. Excellent. You covered my second question in there, which was specifically on the ransomware, is that provides a much more acute pain, if you will, than my reputation got hurt. If the doors are shut and no one's coming through, that's, you're going to feel that hard and fast. Whereas, if I lose customers over the next 18 months, it might be harder to measure. It might be harder to realize that that was as a result of the breach. So excellent points.
Thank you.
So the next thing that I'd like to talk about then is once, if you've successfully established, okay, we've got this problem, we've got to do something about it. It's critical for our business to go down this path. Where should these people start? And here I'd like to look specifically at your experiences through these interviews of what went wrong with the breaches, with the groups that you were able to talk to. You mentioned in the paper that many of them, if not most of them, could have been avoided by taking better precautions, either having better security apparatus in place or by having, and this is an important point, having and practicing and following their privacy policies. So can you talk a little bit about that? How did people get bit, and how could they have avoided it in these cases?
There was a time that from a technological standpoint, we couldn't prevent breaches. But now the security technologies are sophisticated and advanced enough that you could rest assured that if you spend enough resources on those technologies, then at least in theory, they eliminate or hugely reduce the capability of a hacker to get into your system. Mm-hmm. However, even the most sophisticated technologies cannot protect you if your human resources are not informed are not cooperative.
Absolutely.
So we talk about two-stage authentication systems and the most sophisticated firewalls and monitoring traffic and everything. If you have everything, if I'm one of your employees and I happen to give my username and password to somebody that I shouldn't, yep, then there's nothing that you could do. They could use my login information and get into the network and have their hands on the information that they shouldn't. So if there was only one thing that all of these 22 CIOs that I talked with unanimously agreed upon was the fact that, hey, we can solve the technology part. The biggest and most challenging part of our day-to-day job is to how to address human errors. Mm-hmm. And it's big. To give you another example is that, I was talking with them and they were saying, hey, you're trying to reduce the click rate on the phishing emails. If they send you an email and say, hey, click on this link and it's a malicious link and you shouldn't, we try to decrease the likelihood of people clicking on it. And the best that they could achieve is 2 or 3%. And 2 or 3%, although it sounds little, when you consider a large academic hospital that has integrated networks, that you may even not be an employee of that hospital, yet you're connected to a network which is connected to their medical network, and you're talking about a university basically, and thousands of users that may receive that phishing attack, even 0.1% of likelihood of clicking is enough for the hacker to infiltrate your system. So that is an example of the human errors and their severity and their potential consequences. So human errors is I think the most important and the most challenging part that CIOs should think about resolving. And I want to be very practical about this, and I say it's impossible to make sure that all the personnel in your organizations are going to follow the policies that you have set forth. So it's better to basically prepare for the disaster. And privacy breaches is a risk that will happen. But what can we do in order to first reduce the likelihood of that breach, and second, reduce the potential consequences of that breach? We're talking about human errors and having access. If we can reduce the number of the people who could have access to different parts of our network, then to some extent we are reducing the likelihood of those human errors leading to any significant problem. So and those are the things that I think CIOs with the extensive knowledge that they have about their organization are the best people to figure out. But I just wanted to emphasize on the fact that hey, your problem are not the firewalls, are not encryption, because I hope that if you're a CIO, you should know you should encrypt. I shouldn't tell you. Right. But the biggest problem is in the human errors, so the focus should be on that.
Yep. And in addition to that error, the knowingly not following policy types issues, and because it's healthcare, the example you gave of the limiting access to specific files, and I'm pretty sure it was your paper that I read recently. I was going into this where I don't know who's going to need access to a patient's data when they come in the hospital, and it could be a life and death situation, and it needs to happen quickly. so I'm going to just leave it wide open. And, then the policy is, well, don't look at stuff that you're not supposed to. And that only goes so far.
That's a brilliant point that you raised. Just hold on a second. The lights went off because I was not moving here.
The sensor.
Yeah, these are the sensors. I don't know how to. Okay, now they're working. Sorry.
Well, you had about a half hour, so that I believe here. All right, 20 minutes in. So
I give you an example. Here at Brookings, they require us to change our passwords every often. And our IT department here makes sure that we do. So it's an automatic request for changing passwords, and if you don't, you cannot log into your computer. So I, as a fellow who has to work here, became really frustrated. Hello?
I'm still here. Did you lose me? All right. We'll be right back.
Oh, you have me?
Yep, I'm here.
Oh, sorry. I don't know what happens here.
Oh, your screensaver just went on probably, right?
Yeah, probably. So
it's timed with the lights pretty good.
As soon as I started to talk about IT services here at Brookings, everything went down.
They'll appreciate that when you share it with them.
Yeah. So the morning that I come to my office and I want to log into my computer and there is a request that says, hey, you have to change your password, and then there are all of these requirements for a strong password. It cannot be a weak password, and I have to change it. I really become frustrated. But I have to do it. There's no other way around it. And sometimes I spend 10 minutes on my computer in a frustrated mode trying to come up with a password that complies with their requirements, and then I forget it. And then I have to call them and ask them to reset my password so I can find another password I can't remember, whatever. But the point is that during that time, the life of no patient is on the line. But if I was a surgeon, or if I was an ER physician, or if I was a hospitalist that had to access the medical history of a patient in a critical condition, and then there was a message coming up that said, hey, change your password right now. And then there was, these pop-up messages that this password is not good enough.
Characters, mixed case, don't use any of these. Make sure you use some of those. Yeah, right on.
Yeah, it would be really, really frustrating. And one of the things, we were talking about human errors. A part of stopping those human errors is good practice management, good human resource management practices. So it's one thing when you're talking with a fellow at Brookings, but I guess doctors are not easy to deal with because they are, saving patients' lives. So, and also they are coming from the mentality that some of them, or let's say most of them, are still looking at IT and security as an overhead, as something that they really don't know how is integrated with providing care to patients. So they're not as much welcoming to all these rightfully adjusted demands of the CIOs of the hospital. So one of the parts of addressing the human errors is to correctly communicate the importance of security practices and privacy policies, and why it is important that you should follow them. To the staff that you have that are not normal staff, they're doctors who went to medical school and are coming from different kind of perceptions and understanding about themselves and the value of the skills that they have, and also are providing a critical service at critical times. So that is what makes the job of a healthcare CIO very different from from what a banking CIO is dealing.
Yeah, right on. Bunch of really important points you made in there. I'd like to jump back to for a second. And the first one is on the idea of overdoing the security. So the example you gave, where it's intrusive on your work, and you got to come up with this crazy password, and then you got to try to remember it. If you overdo the security and you don't provide good tools for helping somebody deal with that, like in that case, a good thing might be to have a password management platform that you've already vetted and delivered to all of your people. I use one called Keeper. It's fantastic. I don't know any of my passwords. They're all nuts, and I never have a problem because this thing comes with me everywhere. So if you can deliver a solution to the people that fits the workflow but still allows the security level that you're trying to get to, that's huge. Because what happens is, otherwise, if I have this crazy password, now maybe I'm more likely to write it down on a sticky note that I keep in my bag or in my desk or whatever, and I'm compromising the security. Or there's examples where if you have to have a certain person come and type like an override code to allow some action, well, then that person becomes much more likely to share their override code with people who shouldn't have access to it. It's like whenever you go too far, you immediately incur the behaviors that you don't want, because people are just trying to get their work done. And that's going to be true, not more true anywhere else than a hospital. And the example you gave, if I come up to the computer, I'm an ER doc and I need information, I can't get in. Well, the person next to me is logging me in, and now I'm acting as them. Now I'm recording stuff as that person and creating a potential huge issue down the road because I need that information now. So that not overdoing it is critical.
Yeah, and what you said is true, not only for security purposes, but also in general for the application of IT in the healthcare. We have the tools, and the tools in isolation on their own, in theory, are working well and should result in better outcomes. The problem is how to integrate them with the healthcare flow. And if there is no common sense there, and if not enough attention is given on how to integrate this new IT system to the workflow of these healthcare providers in a way that it doesn't interrupt what they are doing, but actually ends up helping them, that is, I think, one of the biggest issues in healthcare IT nowadays. As I said at the beginning, from the technology standpoint, we don't have the problem. Mm-hmm. But it's human errors, and human errors, I want to clarify the fact that I don't mean that it's the fault of the people. It's not their fault. Mm-hmm. It's a system design failure that you couldn't come up with a workflow and integrate information systems in a smooth and comfortable way, such that the users will enjoy using the system and at the same time comply with the policies and requirements that you have set forth. So it's human errors resulting from faulty system design.
Yes, agreed. And then the other one that point that you made that I think is really important, I'd like to expand on a little bit, is the fact that not all of the users of the system, the doctors that have to use the EMR systems, are realizing benefit from doing so. So there's that kind of general, I have to do this already feeling out there. And then on top of it, you start to throw in the security hurdles. And now you're kind of 2 layers removed from anything value to that person. And that is definitely going to create situations where they not only make those mistakes, but just make those judgment calls where it's like, screw this, I'm not dealing with it right now. I'm just going to, whatever it takes to get my work done is what I'm going to do. So I think a big part of this conversation going forward needs to kind of eliminate that 2-level separation. It's like we've got, if we're going to continue to force doctors into these EMRs on a regular basis, that we got to make sure that they are feeling a very real and tangible value from doing so in their delivery of care, that it's not a huge interruption. because then that puts us in a better position where now we're securing the thing that's valuable to you as opposed to something that's not.
Absolutely. And, you know, as long as something is, you know, introduced in an industry in a natural way, that is exactly what is going to happen. So let me give you another example. I was talking, one of the breaches that happened, and I was talking to the organizations like this. You know, they had a privacy and security policy which indicated that every laptop should be encrypted. And as soon, and you should not leave your laptops in a place that is easy for others to access that. So you cannot leave it in your car on the back seat. If you have to leave it in the car, at least put it in the trunk. And then the other thing was stated that, hey, you should also make sure to notify us immediately in case you lose the laptop. So I mean, the organization knew all of these things, and they had a policy that stated all of these things. So, and then there was a training program to make sure that all the staff also knows about this. So what happens is that they have these training courses, and then there is this doctor who doesn't attend the classes because he's busy, and doctors are always busy. So he has a laptop which is not encrypted because if to encrypt the laptop, the IT department needs to borrow it for, I don't know, some time, maybe half an hour or 1 hour to encrypt it. And he says, oh, I need the laptop right now, and I'm too busy, I cannot give it to you. So the laptop goes unencrypted, unencrypted. And the doctor, by the way, because he didn't have time to attend the class, leaves the laptop on the back seat of his car, and the laptop gets stolen. And to make things funnier, the laptop gets stolen on the evening that this doctor wanted to go on vacation. So he didn't notify the IT because he didn't want to interrupt his vacation. Why? Because he didn't care. That's a very important thing. So what's the big deal? It's just a laptop, you know. So he goes on vacation for 1 week and then returns and notifies the healthcare organization that he's working with. And so what happens is that they're going to have a delay in notifying OCR subsequently, and OCR takes it very badly, and you know it unleashes another whole other consequences coming from OCR. And
now they're coming in to audit you with a chip on the shoulder.
Yeah, and everything goes back. And these are all happening because this physician didn't care. And didn't believe that the medical information that he has access to is of significant value, and he is responsible to make sure that it's being kept secure. And you know, all of these things happen. So but the same physician, if you ask him, I'm pretty sure that has a passcode on his cell phone. And if he loses his cell phone, he will, if he's using an iPhone or even a Samsung phone, uses all these services to track where the cell phone is immediately. He doesn't wait to return back from the vacation to go look for his cell phone. He will stop the vacation, make sure to find the cell phone, because he has some family information, private information on the cell phone that he takes very seriously and are really important for him. And one wants to make sure that it's being kept secure and private, but that's not happening for the medical information.
No, that's important. So we've been focusing up to this point on how do I reduce the probability of having a risk. The other half of this equation that you mentioned was how do I make it less damaging in the event that I do. So let's jump over to that for a little bit, and let's talk about what organizations can and should be doing right now to lessen that after breach expense, disruption, whatever else you can think of.
Mm-hmm. So from a regulatory standpoint, you know, as soon as you realize that you have been a victim of a breach, you have to report it to OCR and comply with the regulations. And I think all the audience already are aware of what you have to do. The other part, which was really interesting to me, was the relationship between healthcare organizations that were either a victim of breach or suspected that they are under attack, hacking attacks from criminal organizations or foreign countries, and the federal government, law enforcing agencies, specifically FBI. Right. I was pleasantly surprised to know that FBI is allocating a lot of resources to help healthcare organizations notice hacking attacks and deal with them. So I was at the Health IT Health Impact event yesterday in New York, which Shahid was moderating, and there I was on a panel that also included a special agent from FBI telling the healthcare providers that how FBI can come to the picture and help them. That is one of the things that I also mentioned in the report and say, hey, it should be easier for the healthcare organizations to communicate with FBI, and was also an issue that I raised during the event yesterday. And, the FBI special agent described how they are dealing with such events. So they have a reporting system, an online reporting system in which you as the CIO of a large healthcare organization can just send a very brief email and say, hey, we think we're under attack. We don't know where it's coming from, but this is the IP. Have you noticed anything? And then it goes to a center, which is being then routed to different offices based on the location that you're reporting it from and other factors. And then they look at it, and then somebody will contact you in a very informal and friendly manner to basically help you, not to
punish you,
question you and punish you. There's no black SUVs, rushing down to the door of your hospitals. There are no agents in black suits and sunglasses. This is some guy who's an IT geek. That is the most important part. Okay. Who's a person who knows what you're talking about. Is going to call you and initiate a process that is going to help you deal with that incident in a much better way.
Awesome. And the FBI folks being in the IT background and being able to have that conversation with you, that was actually one of the complaints that you came across in your paper there, was that the OCR auditors are not always from that IT background and don't even quite understand it.
They are never. It's not that they are not always. I think none of them is a technical guy. All of them are attorneys and lawyers.
So what can an organization do? And this is one of the things that I always preach is the be audit ready, and that means be ready to deal with that person. Be ready to present the information to them. Have your staff understand what the things are. So what could they do to be audit ready? And what are the things, if any, that you can think of that we can do to prepare specifically for the fact that we're going to be dealing with a very technical issue with a non-technical person, a non-technical team?
Yeah, so I think we're talking to CIOs and IT geeks. And if you are waiting for the federal government to come and save you, you're already behind. The only guy who can save you is you and your colleagues.
Yep.
Nobody else. So the best thing to be ready is to share as much technical information as you legally can without compromising privacy and your own security with your peers, and learn from each other's experiences. I was in another event that we're saying that there are solid ways through which hackers can share their lessons learned about how to attack healthcare organizations. Yep. But there is not much room for the victims to say, this was how I was attacked. Now this is the lessons that I learned. Hey guys, make sure that you don't repeat my mistake. So learn from the mistakes of each other and share the information even before they happen. So one of the things that the other CIOs told me is saying that there is a guy among our group of CIO buddies that is monitoring the firewalls constantly, and we don't have the time or we don't have the interest to monitor our traffic constantly. But this guy just loves to do that, and he as soon as he identifies a suspicious IP, he just sends this to all of us to say, I'm seeing a lot of traffic coming from this specific IP, and we are in the same geographical vicinity, so we just block it.
Yeah, that's awesome.
And prevent anything from happening. So practices as basic as that could have significant impacts. That is one of the things. So first of all, communicate with each other. Second, if OCR improves its reporting system so that when an audit happens and OCR does its extensive investigation that takes about 2 years to complete, share that information. I mean, let us know what happened. Right. Let us know how hackers attacked us. We don't know that. Information is not shared there. The only thing that is shared is the wall of shame and the name of some organizations that were the victims, and we don't know to what extent they were victims, or they did something faulty and it was their own fault that the breach happened. So it's really bad. So there must be much more transparency and much more detailed information out there, because frankly, what OCR is doing right now is not helping to prevent and is not helping to share information, and to some extent is misleading. So the report talks in detail about how to improve that process. So information sharing between providers, information sharing between OCR and providers, and information sharing between healthcare organizations and law enforcement agencies, including FBI, are the three things that I think are not necessarily or should not necessarily happen after a breach, but could happen before a breach and help organizations to be ready.
Right on. And then in terms of, again, the after the fact stuff, I just want to make sure we didn't miss. You pointed out one, and this has been one that I've been blown away by as a systems guy for the last 15, 20 years, is backups. People don't do the backups right. And normally I think about this more from a preventing loss of data because your system's down or whatever. But nowadays, because of the ransomware attacks coming up, and then simply having, this was the point from your paper that I just hadn't really thought about before, but just simply having that historic view so you could very clearly demonstrate what was touched and what wasn't, so that you could focus your response to just those records. If you had 1 million that were potentially touched, but you can prove only 1,000 were, now you've got 1,000 letters to send. You've got 1,000 monthly subscriptions to. There you go. I don't know why the word's not coming out, but that's the thing you do. And then you've got 990,000 people who don't have to get a letter telling them that maybe possibly something happened to your stuff, so you should be worried about it, when it just wasn't necessary. So it's like, I thought that was a really important point. But with the backups, I don't understand why people don't do backups and don't test backups. Did you come across in your study anybody who could have benefited from having that didn't, or have any information for why companies would not be doing good backups and testing them?
I think they just don't care enough to do that, because Again, I get back to the very first point that I made. From a technological standpoint, it's possible. Backing up is not a state of art. It's something that even you, using your own personal computer, should do once in a while.
Sure.
Store your information. If something happens to your laptop, at least you have your information. You know what happened and what you lost. So every CIO out there knows it, and they know the importance of it, but they don't care. And they're not willing to spend the resources on that because, if I don't know what happened, I have to inform more people. But again, it's very difficult to quantify the value.
Sure.
And go argue for it. Or again, even if it's easy to quantify the value, the dollar value of having a backup server in place, it's again very difficult to persuade your CEO to let you do that. And you have a ton of other things that it doesn't come up into the list of your priorities. But again, as I said, these ransomware attacks were the best thing that happened in the healthcare industry in regards to patient privacy. They were a very important wake-up call, and I think the hospitals will now take it much more seriously. And the other point that I want to make, which I think is the most important recommendation that I have in this paper, is having a cyber insurance market. So I said the hospitals do not care about backing up, and they're not prioritizing patient privacy and health IT security because they don't have any business incentives. But now, if we have a cyber insurance, just like malpractice insurance, through which you have to pay annual premiums in order to purchase insurance from a cyber insurance company, and if you experience a breach, your next year premium will become so high, then that alone would be enough business incentive for you to, first of all, go hire a CIO that knows what he's doing and then listen to him. Because otherwise, you're going to experience a breach and you have not backed up. So although only 1,000 of your patients may have their records accessed, you have to go notify all 1 million patients that you had, and the cost of response skyrockets. The next year, the insurance company says, well, I'm not going to insure you, or I'm going to insure you only if you pay me 10 times the premium of the last year. So now that's the time as a CEO that you will feel the burn and realize that you have to go hire somebody who knows what they're doing and then provide them with the tools and resources that he or she requires to ensure the security and privacy of your patients.
Yeah, excellent. And that really creates an organization that'll insure who has a very strong incentive to help you not get hacked and to help you do the right thing. And then beyond that is in the event that you do get in trouble, you do have a breach, you've got somebody else in your corner now who is very interested in minimizing your expense and your fines and everything else. So insofar as that organization like centralizes that expertise and then does it for a bunch of others, it's a way to get to some of that collaboration you were talking about. I think it was an excellent point. I'm glad you raised it in general in the paper. My question for you is, what's between us today and the world where everybody has cyber insurance? Is it just a knowledge thing? Do they not know it exists? Is it a cost thing? Is it there's something missing from these services and policies?
I think the only thing missing is time.
Okay.
So we need more hackers and more lawyers. We need more hackers to attack healthcare organizations so that they know, and we need more lawyers to go sue these healthcare organizations for breach of patient information, which is very difficult at the moment, as I understand to do, or this is what's going to change the whole equilibrium. If there is a lawyer out there who could successfully sue a hospital that was a victim of ransomware attacks, that they couldn't provide the healthcare services that was required to the patient because they were not able to access their computer systems, it would be a game changer, because there would be hundreds of similar lawsuits coming after these ransomware. So, so the hospitals would be hit not only by the ransom that they have to pay to the hackers, but also to the settlements that they have to pay to the patients that could successfully prove that their safety were compromised as a result of the hospital's negligence in providing and securing their systems. So that would be just as necessary as malpractice insurances today. I don't think there is even a single physician out there who doesn't have malpractice insurance and who doesn't appreciate the value of having that. I'm pretty sure that in a couple of years or even sooner, every healthcare provider would also understand the value of having cyber insurance, and then there would be a more mature supply.
Right.
And the supply side, right now, the cyber insurance companies really don't know what they're doing. They don't have enough experience. They don't know how to assess risk. They don't know how to underwrite risk because it's a new phenomenon for them. But as there's more demand from the healthcare side, there would be more supply from the cyber insurance side. And at some point of time, they will know what they're doing, and everything will play out very beautifully.
Yeah, sure. And on the malpractice insurance, that's one that if you're not carrying it, many, if not all, insurance providers will drop you and not allow you to see their patients. So there's, basically you have every incentive to go and get that malpractice insurance. As adoption for cyber insurance picks up, and it's ubiquitous and you have to have it. If you don't have it, that might start to become an indicator to your trading partners, and that these people probably aren't doing what they're supposed to be doing if they're not willing to go out and do the policy and everything else. So that could be a strong motivator too at some point. We did have a question come through here on the right, and we're right at time too. Do you mind if we go over for a few minutes and just answer this question? Go ahead. All right, so it's from Giannotti here. Is there a big market for white hat hackers in healthcare? And below that, he wants to know, and who would pay them? The one thing I've seen is from the cloud hosting providers, like the big national outfits that are really selling their services and claiming the HIPAA compliance and high security. Some of them, the higher end ones, do have these red teams that are former military, former NSA types that are proactively going out into the counterattacking, if you will, or are proactively looking for things. So I have seen that. In your travels, have you seen it from the hospital standpoint, from any of these groups that you talk to? Does anybody have anything remotely resembling that?
No, from those group of people, which I admit it was a small sample because it was very difficult to persuade people to talk to me about the privacy breaches. This issue is not brought up, but I imagine if there is, such services, then it should logically be paid by the organizations who would like to test their security and see where their weaknesses are so that they can improve. And as I said, I said that security is not on the top priority of the healthcare providers, but it is in that list, although not the first place. And there are many healthcare providers who value privacy and also have the financial resources that they can spend on these things. So there are some providers who are willing to pay for that, and there's a market for the service of these for such services, but the market is not as big as it should be.
Got it. So I think, yeah, definitely at time here, and we got through a lot of what we had hoped to talk about. It was a huge topic, though, and as I read through your paper and I tried to distill it down and produce my weekly blog post to kind of feed into the chat and everything, it was hard to cover all that ground, man. There was a lot of good stuff in there. There's like plenty more that I'd love to talk with you on this, but I do think we should wrap and not overdo it for today. Thank you so much for coming on. I'd love to have you back sometime and possibly on another one. Actually, this cybersecurity or cyber insurance is one that I, after reading your paper, I'm really compelled to dig into and learn more about. That might be an upcoming show in and of itself, I think.
Absolutely, and thank you very much for having me. Yeah,
awesome. And just in parting, because you threw out the the half joke that we need more hackers, we need more lawyers doing the suing. I kind of have I have an idea that we could throw out there to the community, and people can think about this, and we'll kill two birds with one stone. Is a group of activist hacker doctors who go out and hack all of the information so that they can have it to take care of the patients. So they'll thus solve the interop problem, but also create the security issue that could then drive us to put better security in place. I think it'd be a win-win.
I think that would be the only solution to interoperability at the moment.
There you go. Awesome. All right. Thanks again, man. I appreciate it. And we'll hopefully talk soon.
You're welcome. Goodbye.
All right. Bye now.